how does acupuncture work? What we are going to describe here is how acupuncture works to heal injuries to the body. In a nutshell, acupuncture directs the natural healing mechanisms of the body to go and heal the areas we ask them. We do that using super thin needles and inserting them into very specific parts of the body that correspond to where the problem is. There's no tricks, no magic, just basic physiology. We stimulate the body to heal itself. It's pretty cool, really. So let's go into this a bit further. When you cut yourself, who heals it? Your body does. And if you sprain your ankle, who heals it? Your body does. But what if you break your arm? Sure, the doctor sets it and puts it in a cast, but who heals it after that? Your body does. Getting the picture now? Your body does the majority of healing of all your injuries, but sometimes it needs help. Your body contains a vast array of healing mechanisms that are at work all the time. Did you know that there are 50 to 75 trillion cells in your body? Who looks after them? Your body does. Your body has its own cycles of generation, regeneration, and destruction at a microscopic and cellular level, and it does it all normally, without you having to think or worry about it at all. Let's call it the maintenance schedule. So how does acupuncture help the body heal itself? When we insert a needle into your body, it stimulates your central nervous system, sending a message to the midbrain saying, "Hey, send your healing mechanisms here." Your midbrain is the command center for who heals what, how, when, and where. Now these healing mechanisms already have a full maintenance schedule. They're not sitting around drinking espresso waiting for something to happen. They're busy, 24/7. When you injure yourself, the midbrain chooses which healing mechanisms to take off the maintenance schedule to go and repair the damage you have done. Let's say you sprain your ankle. Your body knows that you need your ankles to walk. It's a high priority, so it sends the troops down to sort out all the damaged tissue and get you back on your feet again. A lot of healing happens quickly, and as soon as you can walk around again, it calls off many of the troops to get back to their normal duties, and it leaves some to finish the job. That's why big pain gets solved fast, and the lingering pain slower. Your midbrain has down-regulated your injury because the maintenance schedule has #1 priority once again. So say you sprain your ankle or strain whatever injury you may have again. The midbrain puts your injury on the list of things to do, but with less priority this time. It would have helped you learn the first time not to injure yourself in this way. The maintenance schedule is the midbrain's top priority. Your repeated strains are not. So much like tendon injuries of the shoulder, elbow, and wrist, or pulled muscles and sprained backs or whatever, the more you injure the same spot, the less attention your midbrain will pay attention to it. Alternatively, you may just be re-injuring the spot faster than your body can heal it. Under these circumstances, your problem goes from an acute recent injury to a longer-term, more chronic injury. This is why acupuncture really works well. Our acupuncture needles ignite your midbrain into action. We sound the siren, push the emergency button, and deploy the troops at highest priority alert. The midbrain rushes its healing mechanisms to where we direct it, and they get to work. The body also has its own pain-killing mechanisms, called endorphins. So when your acupuncturist has the treatment right, your pain should go away while the body is healing the area. And that is how acupuncture works at healing injuries to your body. Great stuff, isn't it?